Hello, it's Jenna Dalton. I am here with Gail Hume, who is a physiotherapist. She actually co-founded, I should say, Lakeview Physiotherapy and Acupuncture in 2006. And she focuses her patient care on women's pelvic health physiotherapy. She is amazing. She is one of the leading physiotherapists in Calgary, treating pelvic health disorders such as urinary and fecal incontinence, prolapse, painful intercourse, and other types of pelvic pain. She is also qualified to fit pessaries, which is awesome. It's a fantastic resource to have. And so she's successfully integrated this into her practice. She really enjoys talking about pelvic health, and she's actually been asked by her peers to provide expert interviews for a variety of online courses and podcasts. She continues to be an organizer and speaker at a number of local events, and she was the lead instructor on the pelvic pain and trauma course at the Cummings School of Medicine, which is amazing. It's amazing to be able to teach all this stuff, I'm sure. And she's also been mentioned in a number of written news columns as well as radio and online newscasts. Basically, all in an effort, it's her mission to improve access to pelvic health physiotherapy. And she's a mom too. She has 2 boys, an 11-year-old and a 9-year-old with her husband. And she also has 2 cats. I love that they're girl cats named Minnie and Lily. So thank you so much for being here, Gail.
Thank you so much, Jenna, for asking me. I think it's a great it's a great time to do online things, as we know. And,
Yes.
As you've said, I like to talk about this. I like to sort of get the word out. So I appreciate you having me.
Absolutely. Yeah, I think it's so important because there's a lot of mystery behind pregnancy and postpartum care for a lot of women, and being able to be educated and knowledgeable about your own body is very empowering. So let's start off in a very broad sense. Can you just explain a little bit more about what exactly pelvic health physiotherapy is, and why a pregnant or postpartum woman might want to consider seeing a physiotherapist?
Right. Well, firstly, I always explain that we are registered physiotherapists first and foremost. So we have done all of the programming, which is a university level. You will find that we'll either be a Bachelor of Science in PT. Actually, probably in the last 8 years, everyone in Canada who's graduated from a program is now a Master's of Science in Physical Therapy. So they've changed programming, and there are still we're moving into entry level Doctors of Physical Therapy programs. So the program is always evolving, and we've been around since at least the 50s. In terms of doing things that were at that time called remedial exercise, and we have most definitely sort of enhanced and widened our scope of practice since those years. And one of those scopes of practice is pelvic health. And so, what we do is, once we've got our degree, and actually some programs, university programs, are sort of instructing those interested in pelvic health before they're done the degree. But it is generally a postgraduate coursework, and a large variety of education that comes beyond that. So we are physios, and we are physios who happen to have a skill set that includes doing, but not always limited to, internal and external perineum and pelvic exams. And so that would be sort of the stand apart in terms of what would be different. But we definitely are also super knowledgeable in sort of getting people to know about their bodies, knowing the etiology behind their pelvic concern. Is it a pelvic concern? Is it something else? Is it something that is a little bit more of I'm going to use the word threatening situation, because sometimes we can have symptoms that we think are very pelvic floor physio based, yet they are actually maybe potentially emergency kinds of things, things that aren't treatable, like bladder cancer, as an example. So we have to know what things we can and what things we cannot treat, or what things needs to be then referred, because lots of women will want to come to us for something that they think we can fix, yet we have to be empowered and knowledgeable enough to send them to the appropriate person as well. So it comes with a bit of probably a good amount of responsibility as well. But you know, why would women who are prenatal and postpartum, why would they want to come to us? You know, it's such a change. It's a time of rapid change in their bodies, right? I mean, all of us who've experienced it, you look in the mirror one day and the next day it looks totally different. Or we're starting to notice different things down into the pelvic area, around the labia, you know, all those things that we're kind of going, well, is that normal? Is that not? So we can help educate women, but we can also sort of guide them through, physiologically guide them through the process of different aches and pains that can come along with pregnancy, and also help them get back into some activity and help them with any concerns, as you've mentioned, prolapse or those kinds of things, or perineal tears or C-section scars. Neck and back pain, because remember, we're still physio, so it's often part of what I do, you know, or wrist pain, you know, the mom wrist. All of those things are part of what I do in a visit. So we think about the pelvic area and we highlight that in what we kind of call ourselves, but we do have a whole lot more that is often treated and discussed in the session. So yeah, we can prepare women, really, essentially.
Yeah, I love that preparation and that education. And I love too, because my whole approach in fitness is, it's like, you can't come to me just for like core exercises or something like that, because the body works as a whole. And so your shoulder could honestly be impacting your pelvic floor. And so we got to make sure that the entire body is working well as a system. So I love that you brought that up, that you're not just looking at pelvic floor health or even core health, you're looking at the entire body and making sure that the moms or the moms to be feel comfortable.
So, you know, it reminds me when you say that, I think of about a picture is, if all we thought about core, you know, it would be like the guy who goes to the gym who doesn't do legs. He's never a leg day guy. And you see him and he's all sort of beefed up above his waist and nothing below. And, you know, for obviously, generally humans, our core is important, but if all we focused on was just what's there, our appendages, our arms, our torso, the rest of our torso, our legs, they impact us. So from a trainer perspective, it's fantastic to hear. I mean, you do need strong shoulders to be a mom, don't you?
Exactly. Yes. Your entire body. It's like, I have worked out my entire life and I have never needed to be as strong as I have now that I'm a mom, in a very functional way, right? Because we need to be strong just to get through the day, not let alone like above and beyond just the motherhood stuff.
Yeah, and I watched a little snippet that you had done, which you were unevenly loading yourself, right?
Yes.
I watched it and I thought, what a fantastic idea. Yeah. Whenever, even if if you have one child who's 20 pounds and your bag of groceries, which, felt like, 15 or more pounds, how do you handle that? Or you have two kids who are two different weights and you're going to carry them, I think it's really practical to put those kinds of things out there for people to realize. Yeah,
absolutely. Yeah, because we want on a regular basis to train in optimal form, optimal alignment, but motherhood, we aren't in optimal form, optimal alignment. So we need to train in a way that our body can handle that. So I love that. I love that. So let's talk a little bit about a lot of women. So by this point, pelvic health physiotherapy is a little bit more well known than maybe it was 5 or 10 or definitely 10 years ago.
Sure. Yeah.
But for a lot of women, they may be thinking, I don't have any issues. I don't have pain during sex. I'm not leaking. I don't feel like I'm going to leak. I don't have diastasis. I don't feel bulging heaviness. I don't think I have prolapse. Should I go see a pelvic health physiotherapist? Like, do you think this is something that every woman should be going to?
Well, a really good example that I think of is probably my first year offering women's health, pelvic health, which we called pelvic floor physio then, but we're trying to expand ourselves a little bit with our terms, is a patient who literally was that. You know, she's in the same age category as me. We both hadn't had kids yet. And she's like, I need to prepare myself for pregnancy. And I went, wow, okay, you know, let's think about this. What would I do with you? And because it was still very new in terms, like, so you're saying it's well known, but shockingly, people were even, you know, this was easily 12 years ago, 12, 13 years ago, where she already had in her mind that I was a good resource for her to prepare for an upcoming possible birth. And she's since had 3 kids. She comes to the clinic every now and then for different sort of tune-ups, and she sees some of my orthopedic physios for different things. And you know, I helped her through that process, and she helped me actually learn all the things that I could do for people who don't have problems, who want to, again, prepare, want to educate themselves, and they want to do the best they can for an upcoming event. And I think, why not, when you're being pregnant? This is a big change. So absolutely. And so these kinds of patients come through my doors fairly regularly. And, you know, the more we get the word out, the more empowered women will be to say, yeah, I think just going and having a bit of a check-in and a check-up with my pelvic health physio is a good idea right now, so that I can prevent things from maybe happening in the future. They want to just get stronger. And a vast majority of people, women in particular, do not know much about their anatomies. And it's a fantastic way to learn. And, you know, they can then pass that on to their daughters if they have, or sons for that matter, you know, teaching them about being comfortable with the right terminology, teaching their kids what, you know, different parts are, just, you know, at the appropriate sort of level. So I feel like I kind of span people's sort of lifespan and that kind of thing when I educate, because I'm always talking about, well, when your kiddos are doing this, make sure of this, you know, some toileting habits or that kind of stuff. So, you know, yeah, I think that's the cornerstone of what we do, to be perfectly honest, is really provide what we know and what we're learning as professionals, and to share and disseminate that with our patients. So yeah, you don't have to have a problem to come check in, but it also doesn't mean you need a lot of sessions. You know, sometimes this is just a once. We're having a conversation. Maybe we'll do a check if we think that's relevant, but maybe not either, right? We might talk a little bit more globally about sort of general everyday things. You know, how to squat better, how to lengthen your hamstrings, how to get your glutes going, some of those kinds of things that then they can kind of go and be really sort of empowered again when they join different exercise classes and those kinds of things.
Yeah, I love that. I wish I myself didn't know that pelvic health physio existed until after my first daughter was born. And I wish that I could have had a checkup and seen what my baseline was before I had my kids, and then like see what some of the changes now, not in like, oh, do I have like prolapse or like anything like that, but just like as a interesting how our bodies change through pregnancy and how resilient they can be after pregnancy too.
It's true. It's nice to know those things, and I don't disagree. At the same time, our baseline is always changing. This is what I'm learning, right? Yeah. Is our baseline is a little bit different here and there, and that's not at all sort of accommodating for, you know, problems that we're just going to, no, we don't ignore those things, but our baseline can change. And so it's nice to know, and it's good to check in on. I agree. Yeah,
definitely. So something really exciting that's happening for you guys at your clinic right now with the whole COVID-19 situation going on. Clinic is closed, but you've started to offer some telehealth sessions. So that is amazing. Can you explain a little bit more about what someone could expect if they sign up for a telehealth session?
Right. Well, as we were talking about before we sort of started sort of press record, we've said like it only took a pandemic to get this going. Honestly, telehealth has been around for a few years for sure. And it has been on my radar before, and now, you know, the world stopped spinning and said, Gail, it's time you just really focus on this for not only just your clients, your patients, but also the staff that we have, our physiotherapy staff that's here, and ways that we can help people and be socially respectful of the distance that we have to maintain. You know, we're not in emergency, urgent situations, generally speaking, when it comes to women's health. So, you know, I think we're well positioned. In fact, I think about the first day that I offered some telehealth sessions, I had 6 people. That's a big day in a clinic. And so out of those 6, how many? No, I had 7, and 2/5 were postnatal. One was prenatal, and one was a patient from before that was neither of those. And when I think about those stats, I think, yeah, like women were just, you know, we're still having babies. Life isn't actually stopped. All of these things are happening. The world is spinning, just in a different angle, it feels. And I want to be able to provide this information. So when it comes to what they would expect, is that I'm going to say firstly what they shouldn't expect, okay? Because I think this is important. And I think I've been sort of watching what's happening globally, and what some other therapists might be suggesting would be okay. I really will tell you that we will not ever ask you to show us your perineum by video. So no sort of clothes off or anything like that that goes to a pelvic exam. We'll not ask you to do anything sort of even on camera that would be anywhere close to going past the labia or anything like that. So I think that's really important. I think the reason why I take that stance is that I think it's very dangerous in an online sort of forum to have that there. And there's been some, you know, memes which are always meant to be kind of funny, but I have stood back and went, that's actually not very funny. I don't want any woman to think that they are, that they should be asked by any healthcare provider that that's okay. That's my opinion. So no, so that's the big question that I think is on people's minds, and I will just bring it up right now. You will not be showing me those parts, or any of my therapist parts, or in my therapist, you won't be showing any of that to them as well, because there's so much we can glean, and so much that we can get a really good understanding about with a good, honest conversation. And that's called a subjective exam. And as I am in now my 20th year of being a physiotherapist, when I think, A, that's shocking. B, I think, you know, that was the part, I think, when I was a newer grad, that it was kind of like these list of questions that I felt I had to sort of really ask. And then as you get more seasoned and you have a lot more experience, these questions are very purposeful. They are not just a question because you should check that off the box of the list of things to ask. They are very purposeful. And so, number one, asking the right questions. Number two, listening to the answers they're giving and interpreting that right. And if we don't know what they mean, ask more questions. And asking some, again, more probing kind of questions that, again, the questions might be very, you know, sort of a little bit like, so is it that you're seeing tissue coming out of your vagina? Is it that when is your pain with intercourse? Is it when he inserts his penis? So we may have those very sort of candid conversations, but again, nothing visual that comes from a personal perspective. And that's why that's why I do my sessions from my clinic or studio location, because then I have all my little props, right? I have my pelvises and I have my diagrams, and I can show people what I'm talking about. But I do think that the ability to have a really nice conversation with your patient from a therapist perspective and vice versa is extremely helpful. And so that's why when I kind of jumped into this, I thought, well, I'm always talking with my patients. In fact, I find that I'm talking a lot with them, probably more now than I did when I was first working, and particularly more now in women's health than I did when I was seeing just a few neck and back pain sort of patients, you know, when I was doing regular physio, ortho physio. but because I think I've learned the skill of that as well. And I would say my therapists are all in that boat where they know how to ask the right questions. So that's one thing to expect. The other thing is that we are on video, so I can get you to move around. And I've had, like, it's been super fun actually going, like, directing people going, okay, well, you're going to be my hands for me. And I'm going to get you to do this movement. We're going to compare what your symptoms of what was feeling in your pelvic floor and your pelvic region or your abdomen. How does that feel differently? And then I'll give you something different to do. Or if I'm wanting to know what I would normally assess with my hands around the pelvis, or if we're thinking about the diastasis, I will get them to be in my hands for me. And I'm literally like peering in, watching them do this. And I think, okay, no, I ask them, please change your hands this way, do that. What does it feel like when you do this? And so we're really working well as a team. And then these are kind of skills that she can go back to and kind of check herself, go, okay, what Gail asked me to do this. And oh, that actually feels like it is better from the last time so, and I'm talking about external stuff as really essentially with that. So they can expect some movement. They can expect, doing some hands-on for me so I can get a bit of an idea of which direction we should go. And then, of course, I give them lots of tips and lots of strategies, and that includes some exercises that we would consider rehabilitative in terms of what's really individual for what their needs are, that kind of thing. So kind of like seeing me in person, with the exception of not having that pelvic exam. And you're going to ask me, well, how do you know they have some things going on? Because, right? Yeah. Because, even me, I've touted for a long time, like, we don't know till we see it. And I still believe that. But again, I think we have to rely a lot more on the woman's sort of experience. And this is where I would say, again, asking them, you could take a mirror, but that's not on camera. That's not with me today. That's between this appointment and the next appointment. Here's a few things I would like you to do. I want you to take a mirror and be laying down and see it. Maybe go now do a stand-up mirror check at your perineum. If you feel comfortable, you could, touch this area. If you feel comfortable, you could insert here with your finger and tell me what that feels like. And then again, her telling me what she feels, I can get a really good sense. And again, I've had that experience so far. Feedback has been fantastic with the patients. And I could tell you that I've got a really good working diagnosis on what they've told me based on what they've said. I can stage what they've told me. I can stage their prolapse based on what they've told me.
Yeah.
And I think that's pretty, that's not going to change my stance on when we're able to see people in person. Doing an in-person check is important. Maybe me doing some of my hands-on manual skills that I do will be important. But, it's not like a percentile that says that, it's 90% of what the therapist does and 10% of what she tells you. I actually would flip it on its head and say, it's 10% of what I can do for you, but my job is to guide you. And my job is to guide your body and empower you with the knowledge that your body's robust, number one. And number two, it will heal itself. And number three, here's the ways we can make this happen faster, by therapeutically intervening that way, right?
Yeah, I love that. It sounds like it's like I've actually been treated by Gail. She was my physiotherapist, and she's amazing. And it was really amazing to learn from her and have all the sessions and everything like that. But I could see it being very empowering to have you walk me through touching myself, feeling things on my own, checking myself out, because that's going to give me a lot more power in terms of me being able to make decisions based on how I'm feeling things in my body and not feel so afraid and not feel so uncertain, because I can actually get my hands on there and I know what I'm looking for based on what you're telling me. And I feel like that sounds amazing. I want to have another session with you just to
learn how to do it. Well, and it has been empowering, I think, for me as a therapist. It's been empowering for my therapists who've been doing telehealth as well. And us going, I don't know, we have more to offer than just our set of hands.
Yeah.
And and just sort of emphasizing that. And I do have a lot of orthopedic physios who are also doing telehealth. So where we're used to using needles and or some hands-on sort of manipulation or mobilization techniques, they're not able to do that, but their patients are getting better and they're all really happy. So again, it is, I think it will enhance us as physiotherapists to really understand what value we can bring to a session, that doesn't necessarily rely on the patient being reliant on what we do for them, but to share that with them. And again, when we are back in person, there's going to be many people going, thank goodness I can finally get that needle in that spot that's been bugging me. I've been rolling it, but it's giving me maybe 60%, and I want it to be 100% gone. So there are times where I think we're really effective with our hands, but this is a conversation about how effective can we be at a distance, and it's surprisingly even better than we could imagine.
Yeah, it sounds amazing. It sounds incredible. So, where can people learn more about booking a telehealth session with you? Should they just email you, go to your website? What's the best route for them to go?
Yes and yes. So we are still managing all of our phone calls. We're not available at the 12 hours a day that we were doing before, but kind of the banker's hours, the 9 to 4 kind of thing. There's always the ability to leave a voicemail if phone works for people. The online world is, we've always been able to have our patients book online. So our booking site, I can say it too. It's we use something called Jane app, and that's what our platform is used as well. They've been a fantastic, honestly, thank you, Jane. As I'm always saying thank you to Jane. Jane is not a person, it's a company, and she is very simple to use, which I think is why they named it Jane. And they actually brought about their online platform about a year earlier than they anticipated, because again, thanks pandemic, it sort of pushed them into that direction. So our booking site that we've had before, which is lakeviewphysio.janeapp.com, and then it's /locations/telehealth/book. But an easier way to even get there is lakeviewphysio.ca, and then there's just book online. And our homepage we've updated, and we're actually in this week we'll have a dedicated page to online appointments. And so in that, I've actually kind of recounted all of the things that we can do with pelvic health, women's health, but also pediatrics. So some torticollis and head shape stuff, so-called plagiocephaly. Lori Walker-Krause is our resident sort of pediatric physio who is doing the telehealth right now for that. She also works with moms, so women's health, as well as breastfeeding and lactation support. So she's a great resource. So I've on that webpage, it's all about what can you get from telehealth if you have a sore back or been in a car accident, and or things we've talked about, and even our Pilates instructors, we have actually quite a few classes and those kinds of things. So on the homepage, and a new webpage kind of starting as part of our website, the online stuff, so lakeviewphysio.ca, and our phone number is 403-249-5253. which we were very clever, literally however many years ago that was, almost 14 years ago, and 5253 is Lake, L-A-K-E, if anyone thinks about that. We, of course, are on Instagram. Our handle is @lakeview_physio, and then we have our Facebook page, which is Lakeview Physiotherapy and Acupuncture. So lots of places to kind of learn some stuff. We'll probably, again, put more information out there as people are kind of in home and needing a bit more information, and doing maybe some short video clips on how to do some self techniques, whether it's some rollering, as I've mentioned, or some myofascial release that you can do for yourself. Some little snippets I think we'll be offering to the public as well. So
amazing. And I'll put all those links below, so it'll be easy for people to get into it. And I'm just so excited about the potential. I was chatting with a friend just the other day, and I said, you know what, like there's so many good things. This is such a hard, horrible time for so many different reasons with the whole COVID-19, but there's so many good things that are coming out of this and are going to continue to come out of this. And I can't help but think of all the moms who are getting fabulous support from professionals like you, who are stepping up and continuing to provide support through time.
And I hope that if there's any mom out there, or, you know, pregnant women, soon to be mom, or any other person who feels like they are being kind of left alone because their physiotherapist is not offering in-person sessions, you know, they can go to our college and our Alberta Association for Physiotherapists, which is Alberta. Oh, hello, I should know that. Alberta Physio Association and College, and they have they've actually asked us as members of the province to say, are you offering telehealth? If so, and there's also a list of clinics who are offering what needs to be defined as urgent or emergency care. And that is an interesting scenario because, again, I said, you know, generally there's not a lot of urgency or emergency to what we do, but sometimes there is. And what they've sort of highlighted in that are first responders, frontline workers, particularly. It's important if they're going to have neck and back strains, they should potentially have. The first line, again, is to do a telehealth because, again, as we've discussed, there's lots we can do to show them and keep everyone safely at a distance. But if there's anything more that, you know, would keep them away from an emergency room, then, you know, that would be designated. So the college and association has that on their website, and people can just do a search. So what's also really fantastic is that because it's telehealth, it doesn't matter what location you're in, with the exception that we are Alberta physios that registered in Alberta, we can only treat within the province of Alberta. So but it does open up the doors if your therapist is not doing any telehealth, and of course they are mandated to be closed, then they can certainly check out other therapists in Alberta who are offering some things for them.
Amazing. That's awesome. Well, thank you so much for doing this, Gail.
Well, you're welcome, and thank you back to you. I mean, I appreciate you getting the word out and getting some information to people when they need it. And yeah, like I said, it's there's some silver linings. There's some cup half full kind of looking that we have to do. And, you know, we also acknowledge it's hard. So if it's not working for them, then it's okay. I think that's the thing people need to know. It's okay. They don't have to run and get a telehealth appointment. They're going to be okay. You know, if they just need to just hunker down and have their moments with their family, and don't feel pressured either way, right? Know that help is here if they need it, and that, you know, when we are able to be back in person, here we are, right? And this is an offering that is available. And I will also mention that a lot of people are probably thinking about finances as well. Because so many people have been temporarily laid off in this situation. What we do offer is a 15-minute discovery session with any of our therapists if they're kind of wondering, like, would this be good at all? So there's that isn't a fee for service. But our sessions, though, so many insurance companies, almost all of them now, all of the big players have all jumped on and said, yeah, you know what? We will cover this. This is the way life is. So if people are kind of wondering, like, well, I don't know if I can afford it, or would my coverage be there, check in with your insurance plan, and you will find that a large majority of them will cover telehealth or telerehab is another word we're using, online appointments, or virtual physio, or video physio. These are all some of the fun names that people have used. All of that is considered online sessions, and most are covering it.
Amazing. Awesome. Well, thank you so much, Gail. Thank you for providing that access and support. It sounds very empowering.
It is. And thank you again.
Of course. Hey, does your body feel pretty different since becoming a mom, and you just wish you could feel stronger and more like yourself again? If this sounds like you, I want you to know that the solution isn't to push yourself harder or work out more. What you need is a whole new way of thinking about your body and the right, proven postpartum fitness strategies. Because you're a mom now, your life and body is suddenly drastically different, and what worked pre-baby is not what will work now. You need a new approach. You need to know how to work out safely after baby. And that happens to be the name of my free program. You can head to jennadalton.com/free, where you can snag 3 15-minute home workouts so you can regain your strength in 2 key areas moms need to focus on the most. And you'll also learn the #1 secret you need to know about postpartum fitness that you probably haven't heard from anyone else, even your doctor. Head to jennadalton.com/free to get it.